Hi, everybody. Dr. Melissa Hague. I am a practicing OBGYN. I deliver lots of babies, but I also take care of women through their whole lifespan. And with me today, I have my friend.
Hi, I'm Dr. Delane Vaughn. I'm a family practice doctor, and I help women with type 2 diabetes reverse their diabetes.
So why is an OBGYN and an expert, really, you're an expert at reversing diabetes? Why are we partnering? Because we have so many women with gestational diabetes that get so many mixed messages on what to do. We are physicians. However, this podcast, YouTube video, however you're viewing this, is not medical advice. We encourage you to talk to your own physicians. We are just giving you some suggestions and things to consider on how you can manage your own body during your journey with gestational diabetes.
Absolutely. On that same note, if you've been started on medications, you have been medicated for how you previously ate. If you start eating differently, those meds are going to have to change. You're going to have a very close conversation with your provider so that they can give you guidance on how to change those meds as you're changing what you eat to keep you and your baby safe.
Absolutely.
All right, so we're going to share some slides here and run through some information for you.
If you haven't seen the other videos in this series, we would encourage you to watch those first. This is video number 4.
Number 4.
Right.
So we're going to give you some strategies today on what to do if you can't get your blood sugar to go down. You feel like you've changed your eating, you've done it for 2-3 weeks, and you're counting your carbs and you're watching your blood sugars and they aren't getting in that optimal range, and your doctor's still talking about medications. What other things can you do? So part of this toolbox is going to be cleaning up your diet, which is something we've talked about in the previous videos. Part of it's going to be time restricted eating, and I'm going to let Dr. Hague talk about that. Part of it's going to be exercise. We talked about that in video number 3. And then we're going to talk about stress management and sleep. But I want you to talk about time restricted eating.
I think the big problem with a lot of what we, and when I say we, I mean the medical community in general, have told pregnant women in the past when it comes to gestational diabetes, is that you should eat all day, every day. Well, what we know now is every time you eat, and I tell my patients, if you put anything in your mouth, it's a meal, okay? So every time you have a meal, your pancreas has to increase your insulin level. And every time your insulin goes up, your risk of insulin resistance goes up, your diabetes worsens if you're already diabetic, and you're creating more trauma in your life than you need to. So what I encourage patients to do is what's called time restricted eating. Now, in the old days, like 50s, 60s, this was how everybody ate.
This was just how you did it. It wasn't anything fancy. There were no clever terms.
No, it was just, we eat 3 meals a day. I mean, I remember my father-in-law talking about how he was never allowed to have an after-school snack because it would ruin his dinner. So he would stop by grandma's house and cheat and get pie. And that was so controversial. And now our kids at school get breakfast snack, lunch snack. They come home and have dinner, and then they have a snack before they go to bed at night. And then we wonder why they are obese and diabetic before they even graduate high school. So it's the same principle with gestational diabetes. I rarely recommend that people do 3 meals a day. So you have breakfast, lunch, and dinner. Occasionally, we'll talk about this a little later, maybe I have some patients that can't get their fastings down, but if they have a snack kind of after dinner, maybe an hour or 2 before they go to bed, that is higher in protein or fat, that may help reduce their fasting insulin. So some of this is really working on your own body and seeing this as a great science experiment.
Absolutely.
It's not a moral issue. That number on the glucometer is not bad or good. It's just a result of whatever you've put into your system. And really managing your diabetes is learning what you need to put into the system to get that outcome that you want. So if you're getting an outcome you don't want, these are some things that you can try.
Absolutely, absolutely. And that time restricted feeding or eating, however you want to look at it, is a great way to, again, limit that insulin resistance. Exercise, we talked about that. That's going to lower your insulin resistance. That's going to lower your blood sugars. We're going to talk about stress management and sleep. Remember, the insulin resistance, lowering the insulin is the answer. If you remember the conversation about kindergartners, if you're in a big room full of kids, there's a low level of noise. You cannot hear the message coming in each word that a child is speaking because there's just this level of noise that makes none of it able to be understood, essentially, is what it comes down to. Same thing is happening with the insulin. If you've got so much insulin in your system and your cells are insulin resistant, they are unable to understand the message coming there.
That's right.
So lowering the noise in that room of kindergartners or room of children allows you to then hear each message from the children in your room or lowering the insulin in your system allows your cells to hear the message of the insulin. Okay.
Right. And we really just don't have a great way of doing a finger stick insulin.
Insulin, I know.
So that would be so great.
The blood sugars are like the surrogate marker for what our insulin is doing.
It's the downstream effect, but it's what we have.
But it's what we can do. So those are the strategies that you really need to look for, ways that you can lower that insulin level. Cleaning up your diet is one of the best ways that you can do that. What does that mean? That means you avoid processed foods, foods that come from a manufacturing plant versus foods that come from a plant in the earth. That's really what it comes down to.
Right.
Your food should look like food that the earth makes for us. That has all the perfect macronutrients, all the fiber, all the phytochemicals, all the micronutrients and vitamins and minerals, everything that you need in it.
And really write everything down. Be honest with yourself. I like to tell myself, oh, I only ate 2 meals today, but then maybe I had a few string cheese sticks here, and maybe I had, so when I'm really trying to change something in my life, I have to write it down, because then I can see, okay, what I did yesterday led to an outcome I didn't particularly care for or wasn't what I was aiming for. So I need to change that today. Some of my patients figure out they can have bananas and do just great.
Right. Absolutely.
Others figure out if I have a banana, it's over. Like my blood sugar is going to shoot up. Or you learn combinations of foods.
Yes.
I have to have a fat and protein if I'm going to have
something like that.
A little bit carbier thing like fruit. So it's really, again, that science experiment of you, where you start to learn what can I do and not do. And a lot of that is going to be based on what your body has dealt with to this point.
Absolutely. It's individual, really. And there's no way that we even know that. There's no test that we can run to say, oh, you're going to manage a banana fine, but that sole over there isn't. We don't know that.
Right.
You just got to test it and find out. The other tools, again, exercise. Remember, exercise increases the glucose, the blood sugar that's floating around your system that we're measuring and telling you is too high. Exercise will increase the uptake of that blood sugar by your muscle cells, okay? And it does it in a way that doesn't depend on insulin, which means that the insulin resistance is irrelevant. So even if you're super insulin resistant and you can't change that today, exercise can help you bypass that entire mechanism, and you bring in that blood sugar and you lower the blood sugar by bringing the fuel into the cells and burning it off. You lower your blood sugar and you do it without having any issues with insulin.
Yeah, I've had many patients that figured out all I have to do is after dinner, 10 squats and 10 lunges and 10 bicep curls, and my blood sugar will be down 15 points. And you just start to figure out, oh, if I do these things, it will impact my fasting blood sugar, or it will make me feel better in the evenings, and then I don't eat as much garbage.
Right. Yeah. Yeah. And those effects of your exercise that can last 24 to 72 hours just from one exercise session. You have to get sweaty, you have to really move a little bit, but exercise is a great way, if you really have cleaned up the rest of your diet, a great way for you to bring those blood sugars down. One of the other things to remember about exercise, there's 100 different ways to do this. Even 10 minutes will help. If you've never exercised before, just get sweaty for 10 minutes. Free videos are found everywhere. Look up Pilates, look up yoga, look up weightlifting, go out and walk, find a great podcast that you like, whatever it is.
You have a great podcast. They should totally look it up.
You should totally
listen to my podcast while you're walking, preparing for life after pregnancy.
Absolutely.
But we cannot underemphasize this enough.
No.
I mean, overemphasize this enough. Exercise is huge, and it's also going to bring down cortisol.
Absolutely.
Which we haven't even gotten to yet. But this can make the difference between you getting through your pregnancy without medication or getting through the pregnancy needing medication to adjust your blood sugars.
And on that note, remember, you're about to sign up for a marathon. You have already signed up for a marathon in the delivery room.
Yes.
Having that cardiovascular fitness to get you through there is going to benefit you and your baby, in addition to your blood sugars. So much goodness that comes from there.
Yeah, the women that come in that say, I want to do everything without medication, which, by the way, I have a lot of those, and that's great.
Yeah.
I tell them, if you want to go unmedicated, you've got to prepare for that. Because there are positions we'll ask you to get into, or things that may help you during the labor process, that if you haven't practiced squatting or lunging or strengthened your core and your lower body, are going to be very difficult for you. So this is also just to make that process easier.
Absolutely. And I always tell people there's limitations to exercise. Exercises are never going to undo
won't undo the pizza patch.
The pizza patch or the Pop-Tart patch or any of it.
No, you still just can't do those things and expect your blood sugars to be okay. even if you exercise after,
Yeah.
unfortunately.
Exercise, great for your heart, great for your lungs, perfect for your soul. It's so good for you, but it
Yes.
will not undo something that you've eaten. And that's just because your body has to process that macronutrient as it comes in.
And don't think you have to do this by yourself. I have a lot of patients that go on a walk with their spouse, take their kids out for a walk. All of our dogs probably need to be walked a little more than they are.
Yeah.
So this can be a community activity at a time that really builds community with your family.
Absolutely. Absolutely. Another strategy, another tool that you have in your toolbox to lower your blood sugars, has nothing to do with the food that you're eating, is meditation. So meditation works because it lowers our stress level. Recognize when we're stressed, whether it's physiologic stress or whether it's emotional stress, psychological stress. The only way your human body knows to respond to that stress is by releasing cortisol into your system. 10,000 years ago, there weren't bills coming in the mail. Nobody was stressed out about any of that stuff. The biggest stressor we had was actually running for life-threatening experiences. Something's chasing you, some tribe is chasing you, whatever it is. To do that physical activity, your body had to release glucose, which is fuel for your cells, into the system. So cortisol is the way that our body developed to do that. So we release cortisol, we get this flood of glucose into our system to fuel our cells. You don't need that glucose to manage a bill or an argument with somebody.
No, maybe to avoid the pizza patch.
Maybe to run away from the pizza patch.
That's right.
Yeah. So when you think about it that way, you're getting this surge of cortisol because of stress in your life, even though it's not the stress that your body maybe is expecting it to be. Meditation helps lower that stress response. It's thought to lower the production of cortisol and adrenaline, and all of these again lead to glucose production in your body. The act of meditating and even yoga, all of these moving meditation practices, it causes your body to turn on the rest and relaxation part of your nervous system and turn off the stress response part of your nervous system. So getting a daily practice to decrease that stress response, increase the relaxation response, tons of free resources online.
Right. And this can look different for everyone. For me, this looks like prayer and just spending time really getting back to where I know I need to be. For some people, it looks like just being in a quiet place with music playing and they just focus on the music and keep their mind empty. But you have to figure out what that looks like.
Absolutely. Absolutely. If you come out of a meditation practice, I do think that our brain tends to drift off to the things that are consuming of it. And a lot of times that's a stressor. So if you come out of a meditation practice and you don't feel relaxed, you probably need to kind of make some adjustments.
You did it wrong.
Yeah. I'm like, I know, can we do it wrong? I mean, like, if you don't come out relaxed, yeah, I mean, that's not the way.
Shut that
brain down.
Yeah.
So find out, but again, there's great online resources. There's Headspace, there's the Calm app, there's all sorts of free stuff on YouTube. Find them, see what works for you, keep trying something until it works well for you. But it's a great way to turn off that cortisol response and lower your blood sugar.
Absolutely.
Sleep is also really important. Sleep is a rough one. People,
I don't get a lot of it. So.
Yeah, people feel like they're out of control of their sleep. And a lot of times, yes, it is part of the human experience to have a couple nights of bad sleep in a lifetime, right? That makes sense. But what can you be doing to clean up or to keep your sleep as protected as possible? This is a graph.
Turn off Jimmy Kimmel.
Yeah, please, for the love of all that's holy, there's nothing on at night that you need to be watching. You need to be getting sleep. So the biology of sleep is that you go through about 5 sleep cycles. That's what this graph shows. It shows 5 different sleep cycles. There are little blue lines separating out each of the sleep cycles. Those are around 90 minutes long. And what you do in each of those different cycles is different. So what you do in sleep cycle 1 and what you do in sleep cycle 4 are different things. You spend different amounts of time in deep sleep, different amounts of time in light sleep or in REM sleep, and your body releases different hormones during each of those cycles too. You can't get to doing what needs to be done in sleep cycle 4 and sleep cycle 5 until you've been through 1, 2, and 3. So you really have to give yourself the opportunity to have that entire sleep, 7.5, 8, 9-ish hours, depending on the human being. You have to give yourself enough time to have that sleep, which is where Jimmy Kimmel.
Right. No. Well, the other thing is, if you clean up your diet, you might have several nights in a row of poor sleep.
Yes.
You are getting used to.
As you withdraw.
Right. Withdraw and dropping your blood sugar levels. But once you get to that better place, what you will notice is if you end the night with the ice cream with the family,
you will not get good sleep.
It'll be crappy.
You will not.
So it really does reinforce once you clean up your nutrition, how much that can help your sleep.
Absolutely. understand that when we're getting poor sleep, we get we get poor insulin sensitivity. So an increase in that insulin resistance, which again is what we're trying to fix. You get an increase in hunger hormones. You get a decrease in hormones that make you feel satisfied. And there are study after study after study that show increased consumption of junk food, of just food that is not good for you, highly processed, sugary, salty, fatty, all the things foods. So give yourself a break, get some sleep to make those decisions in the day easier.
And if you do get a night of poor sleep, what doesn't fix that is Doritos. Like,
Never.
Don't go from that to eating your high carb snacks to stay awake. It doesn't help. Drinking a lot of water helps. And
getting some sleep helps.
And then getting sleep again does make a big difference. Yeah. But if I have a bad call night where I'm up a lot, what I have learned is I am much better off not eating breakfast, drinking lots of water, having maybe a glass or two of coffee or tea. But if I overdo it on that, then
that's also bad.
Also not good. But then really focusing on mostly proteins and fats in what I eat during that day, so I don't get the sugar high and low.
Absolutely.
I feel way better.
Absolutely. So some things that you can do to help improve your sleep. Again, sometimes
turn the light on.
Yeah, turn all the lights on and drink all the caffeine.
That's right.
Yes. So sleep hygiene is what we call this in medicine. Watching your light exposure. When you expose your eyes to light, it shuts off melatonin production in your brain. So in the 2 hours prior to going to bed, you should really dim the lights. You should not be exposed to bright lights. You shouldn't be on your computers. You shouldn't be on your phone. You shouldn't be watching TV even really. You should really limit the amount of exposure to your eyes with light. So
and look around your bedroom.
Yeah.
I mean, it's amazing how many things in your room
have light on.
Have a lot of light. Yeah. Even the alarm clock.
Or your phone.
Don't have one anymore because they're overrated. But
right.
The alarm clock, a lot of those are bright.
They're very bright.
The second you have a little sleep disruption and then you see
your eyes, yes, you'll get that light and it will shut down the melatonin production in your brain that's keeping you or it's triggering you for sleep. Yeah. Avoiding caffeine, you're going to be avoiding alcohol, but in the postpartum phase, make sure if you're doing that, the alcohol will impact your sleep at that point. These both stay into your system for about 20 hours.
That's unfortunate.
And they negatively impact the way you're cycling through those sleep cycles. So we know alcohol inhibits your ability to get into REM sleep. So in all the sleep cycles you go into REM sleep, but you do a lot more of REM sleep, which is restoration, which is healing, it's memory, banking, all of those things happen in REM sleep. Most of it happens in sleep cycle 4 and 5.
That's why you wake up at 4 a.m. if you've had too much to drink.
It is. It absolutely is. It absolutely is.
I've heard.
It will make you sleepy, but it will not actually make you sleep. It will just make you drowsy. It doesn't put you in those sleep cycles. You don't cycle through them effectively and you don't go into REM sleep. So you're not getting memory put into your memory bank. You're not getting the restorative parts of sleep that you need. I get that alcohol is probably not an issue if you're watching this for gestational diabetes, but caffeine does the same thing. Benadryl does the same thing. All of those meds do the same thing. They inhibit your brain from going through those sleep cycles. So avoiding those things and remembering that they stay in the caffeine. If you're drinking caffeine at 4 o'clock in the afternoon, it is not going to be out of your system and not impacting your sleep by the time it's time for bed, even if you feel like you can fall asleep with the caffeine on board. The other thing, temperature is really important. So your room should be cool, but your body has to drop about 2 degrees Fahrenheit, your core temperature, 2 degrees Fahrenheit for you to drift into sleep, which I just think is crazy. I think that's a huge amount, but it is what it is. It's what the studies say. So keeping your room cool. First is that. Second then is you can take a warm shower or a warm bath that shunts the heat from your inner part of your body to your external part of your body and lets it evaporate off essentially. And you cool that core temperature. You can bring that temperature down to help you set sleep in. So those are some sleep hygiene things that you can do.
Well, and when you're pregnant, man, you're hot.
Yes, you are.
You have a human heater, literally.
Nuclear furnace.
Literally. And I've had some patients that's when they invested in a chili pad.
Yes.
So there's a lot of different products out there, but there's a lot of products that it's like this webbing of tubing that you put under your sheets, and it just keeps your side of the bed at a constant whatever temperature you set
it up.
So, especially as we get into this Kansas summer, oh my gosh.
It's 90 something today.
Yeah, it is
fabulous. So that's what we have for you. There's a number of different things that you can do. It's not only about your food, but there's no amount of sleep that you're going to get. There's no amount of Zen meditation you're going to get to that's going to allow you to eat at the Pop-Tart patch or the pizza patch, right? Like you're going to have to cut those things out. But if you do that work and then you're seeing that you're not getting those optimal numbers, start implementing some of these tools and see how it works for you.
Your baby will thank you for it.
They will. You'll thank
Someday.
yourself for it. If you are finding this helpful, tell your friends. Most of all, tell your doctor so they know what you're doing, but so they can evaluate this. Maybe they learn something, but more than that, maybe they can start implementing some of these techniques and strategies with their own patients.
Absolutely.
All right, we'll see you in the next video.